Thank you so much for your presentation. Is this working? Again, thank you so much. In the following minutes, I will address the topic of implementing improved delivery of secondary prevention care, and I want to share with you the World Heart Federation Secondary Prevention Roadmap. I have no conflict of interest for this presentation, and just to start, I want to introduce you what's World Heart Federation. Probably some of you know about this organization, some other not. So, World Heart Federation is an umbrella organization representing the global cardiovascular community. Our main aims are to connect, lead, and inspire the cardiovascular community, to translate science into policy, that is very important, that is implementation, to influence agencies and governments, and to stimulate the exchange of information to achieve heart health for all. Working together, this slide is just to show you that we are the only non-governmental cardiovascular disease organization in official relations with the World Health Organization. We unit more than 200, here's a 220, this is an old slide, now we are 242 members, including heart foundations, patient groups, and scientific society from more than 100 different countries, and China is present in our organization. And one of our development, our initiatives is that we call roadmaps. And I want to share with you what is a roadmap. The roadmap are a global framework that can be adapted and used at national and regional level. Their purpose is to summarize current recommendations to reduce the burden of cardiovascular disease that are proven, practical, and cost-effective. Second, highlight obstacles to implementing these recommendations. Third, to propose potential solutions for overcoming these obstacles. And fourth, to provide tools and strategies to adapt these solutions to local needs. So this is the complete group of roadmaps that we did during the last 10 years, including tobacco control, hypertension, rheumatic heart disease, that is very important in some countries, atrial fibrillation, cholesterol, heart failure, cardiovascular disease, and diabetes, Chagas disease, that is very important in my region, digital health, fixed dose combination, and my colleague Dr. Juanate mentioned the polypill, so we have a special development in fixed dose combination and polypills, and secondary prevention. So the idea with the roadmaps is to adapt these roadmaps to a national level using the tool that we call World Heart Federation roundtables, that are roundtables that put in the same table all the stakeholders about a problem and to look for a national action and a national roadmap. So today we are going to address the topic of our secondary prevention roadmap that was updated 1 year ago. This is the document that you can have for reading in our web page. It's completely free for everybody, and you can look for straight from the web page of World Heart Federation or through our journal called Global Heart. So what's the science that supports secondary prevention of cardiovascular disease? And I want to summarize some current knowledge and practices that probably I will repeat some things that Jose Ramon said. Let me show you, first of all, what's the burden of non-communicable disease worldwide and in China. Worldwide, 72 of the burden of disease is from non-communicable disease. The non-communicable disease are cardiovascular disease, including stroke, diabetes, cancer, and pulmonary chronic disease. But in China, you can see that 87% is this kind of disease, non-communicable disease. So this is the main challenge worldwide, but especially here in China. 33 deaths are from heart disease. So 1 of 3 deaths around the world are from cardiovascular disease. And it's near double the cancer. Please, I'm not saying that cancer is not important. Cancer is very important. But cardiovascular disease is very important too. And here you have the cause of death worldwide, and you can see that cardiovascular disease cause cardiovascular disease cause more than near 20 million people death by year in the world. What's happening here in China? 5 million of death by year in China. So 1/4 of worldwide death are from here, from China. So I told you that 33% of all global death, and what's very important is that more than 75% of these cardiovascular deaths take place in low and middle income countries. Like my country, I'm from Argentina. And this is the most important slide I can show you. That's saying that 80% of cardiovascular disease, including heart disease and stroke, are preventable. So we have primordial prevention, primary prevention, secondary prevention. From the population view, primordial prevention is the most important prevention. But for us as doctors, as physicians, secondary prevention is the most cost-effective prevention. So we have to take care of all this kind of prevention. Today we will focus in secondary prevention. So which are the pillars of secondary prevention? I will repeat some concept that my friend Jose Ramon said. The first pillar is cardiac rehabilitation and lifestyle modification. And this is from the American Heart Association: to eat good, make exercise, control your glucose, your the weight, lipids, blood pressure, not to smoke, and to sleep appropriately. What's the tools we have for reduction of relative risk of cardiovascular events with different secondary acute myocardial infarction prevention strategies? And Jose Ramon showed a very similar slide: aspirin 15%, ASA 23%, beta blocker 23%, statin 29%, influenza vaccination, and I want to highlight that we have to vaccinate our patients. 29 is like statins, and smoking cessation 36%. So the second part of my talk is implementation. How to translate science into policy to improve secondary prevention. And I will start with a survey that we did from World Heart Federation. We have data from 60 different countries. We have more than 260 responses around the world. of our survey, and I want to share with you some data from this survey. 6 months post-event, about 50% of individuals persist in smoking, and 60% do not adhere to physical activity guidelines. Around 1 in 4 patients do not adhere to ACE inhibitors treatment, and 1 in 5 to statins and beta blockers. Only one-third of patients with cardiovascular disease seems to attend some form of secondary prevention program. In our WHF survey, only 7% of the respondents felt that more than 75 of their patients adhere to their physical activity program. And only 3% felt that more than 35 of their patients adhere to a healthy diet. 1 in 2 respond from low income and lower middle income countries perceive lack of access to healthcare system for patients with known cardiovascular disease. And across all countries, income levels, 52% of respondents acknowledge that the lack of availability of priority lifestyle intervention programs as a roadblock. 40% of the answer from low-income and low-income countries agreed with the statement that healthcare professionals are not aware of guidelines. And 48 of the respondents from low-income countries perceive the lack of affordability of priority medication like aspirin, beta blockers, ACE inhibitors, and statins. 60% respond that polyps were only sometimes and rarely affordable, and 13 of they were never affordable. So, what's our idea with these documents? To focus in recent implementation strategy for secondary prevention. First of all, to use digital health to reach patients, especially in some situations like rural areas. The use of fixed-dose combination therapy, and Jose Ramon showed you the impressive results of SECURE trial about the use of polypill in secondary prevention. The innovative medical treatments as anticoagulants, novel lipid-modifying agents, newer anti-diabetic agents, SGLT2 inhibitors and LGP1 agonists, and anti-inflammatory medicines, let's say colchicine. And let me highlight again influenza vaccine as a very important tool in secondary prevention. We took this document called Secondary Prevention Roadmap and tried to adapt this roadmap for secondary prevention of cardiovascular disease to local needs across the world. And you can see on your right different roundtables that we did in different countries, including in China. And I will not review all these recommendations, but just to have the framework. There are some patient-related solutions, and the most important is to educate patients. We have some healthcare professional-related solutions, and the most important is to what we are doing here, is to train ourselves and to educate ourselves for secondary prevention. Very important in many countries around the world is the health system relevant solutions to strengthen the role of primary care health system. For us, the key of prevention is in primary care health system, even for secondary prevention. And there is a lot of solutions related to priority interventions. So in conclusions, my dear friends, people having experienced a previous cardiovascular event or with known atherosclerosis of high risk are at the highest risk of a new episode and are generally easy to identify and contact for care. Medications, lifestyle modification, and cardiac rehabilitations are known to reduce the risk of repeated cardiovascular events and supported in many guidelines. Despite this, the number of eligible patients receiving guideline-directed secondary preventive care and adhering to medication and recommendations is unacceptably low and inequitable. So efforts to overcome these barriers to implementing optimal secondary prevention care at multiple levels are urgently needed and should focus on warranting availability, affordability, and accessibility of medications, improving health literacy and patients' empowerment for adherence, training and dissemination of evidence-based guidelines, adapted care models to ensure optimal care at discharge, community-based care, and integrated care. So it's my pleasure to be with you today. Thank you so much for your attention. Thank you, Dr. Zhang. And it's really, you are really very welcome in WHF Federation because let me say that I'm based in Buenos Aires, Argentina, a long way from here. The WHF Federation is based in Geneva, in Switzerland. But who are WHF Federation are all of us. So thank you so much for being today with us.